Hi everybody, I'm Katie J. and I'm the director of the National Association for Weight Loss Surgery, and I am here talking to a very special person today. This is Dr. Lindsey Ricciardi, who is co-author of a book entitled
Obesity Surgery, Stories of Altered Lives.
Right. And I have heard nothing but great things about this book, and I wanted to tell you guys about it so that maybe you could read it too. I just have one question for you, Lindsey, and that is, if somebody were to buy the book and read it, what would it really do for them? If it was a weight loss surgery patient, what would it do for them?
Well, I think aside from learning about the physiological aspects of weight loss surgery, we actually talk very little in this book about that. Ultimately, you're going to know the numerous and varied ways in which your life might change, and that's has to do with how you feel about yourself, how you feel about your relationships, how the world reacts and responds to you, what your future goals are and how that's affected by weight loss and weight loss surgery. So I think all of the different psychological and social ways in which weight loss surgery could affect one's life. To give you an example, one of the women, there's a lot of quotes throughout the book. It's based on 33 patients and in-depth interviews. So each patient was interviewed for 90 minutes, and they were asked, tell me about the ways in which your life has been affected by weight loss surgery. And one of the women talked about riding the elevator with the same coworker for 10 years, and about 6 months after surgery, he turned to her and said, "Good morning." And it pissed her off
I bet it did.
Because she thought, I'm the same person I was, but then that issue of being the same person, a lot of people say, well, I'm dressing differently and I'm reacting to people differently and my self-esteem is better. So just how people have adjusted to and experienced all the ways in which weight loss surgery can affect their lives.
Okay. I have one other follow-up question. Well, actually two come to mind. One is, what about for a patient who's further out from surgery, who might be either having trouble with regain, or they feel they haven't really lost the way they hoped they would, or they're struggling in some way?
Well, the people who participated in the interviews range from 6 months to 11 years out of surgery.
Wonderful. Okay.
So it was a really nice range of viewpoints. So you get to see experiences. I mean, the woman who was 11 years out spoke about still going to sit down in a chair and thinking if she's going to fit in that chair or not.
After 11 years?
Yeah. So
wow,
really
that's interesting.
Illustrates the how extensive some of the body image, or feeling as if she was still a fat person passing, in an average sized body. And so it really talks about a lot of those more deeper existential issues and internal struggles and ways of thinking that you can relate to across all levels of the weight loss surgery experience. The other thing is, my co-author and I, the second half of the book is devoted to more of a intervention program or treatment manual that's more self-help based, but a lot of questions to help people get on track, get back on track, or prepare themselves for weight loss surgery. So I think there's a lot of instruction as to how to get recommitted, how to get remotivated, how to get kind of back into it, and also how to address what the obstacles are. Relationships came up a lot in that book. If you lose all your weight and you're feeling great and you're healthier, but every time you leave the house, your husband questions where you're going because he's feeling insecure, that poses a whole nother dimension and challenge to that person's life experience. So I think it can address everybody, regardless of where they're at and how they're doing.
Okay. So I guess the final question would be also, though, it sounds like it would be a really great book for people like support group leaders or professionals who are maybe trying to help patients, but they don't necessarily, it's a relatively new field, I think, for some people anyway. So it'd probably be good for people to get a real sense of getting inside the minds of weight loss surgery patients so that they can help them better, don't you think?
Absolutely. And I think that the value of that is the patients' quotes, and they were really gracious and provided very rich, detailed, elaborate quotes of their experiences, and the variety of themes. So you could have, you could talk about relationship changes in one experience. You could talk about the last resort, feeling like there was no other option, and there's a whole section dedicated to people's turning points, what finally made them make that decision, how people feel about themselves. There's a whole chapter devoted to that. So you can have different themes to even lead discussion.
Oh, that's a nice idea. Yeah. Okay. Okay, that's great. Anything else you want to tell me before we say goodbye?
I think that would be it. Just
Where can they buy it? If people wanted to get the book, where would they go?
it's published through the University of Nevada Press, but it's available on Amazon.com, usually at a discount on their website. So that's probably the best place to get it.
Well, the funniest thing I would say is that I have bought her book and I have not read it. I have to be totally honest. But the reason is I've been getting such great reviews about it that I keep giving my copy away. So.
Good.
I apologize.
And I was
for
going to
not
give
having
you
read
one,
it.
but I gave one away recently too. So thank you.
Well, congratulations on your book. I think it's really awesome.
Thank you.
I wish you well with it.